Sometimes patients need to have a surgery called a laminectomy. Laminectomy simply stands for removal of the lamina.
Laminectomies are performed when there is a condition called spinal stenosis, or compression of the nerves in the spine.
So in the lower part of the spine and upper part of the spine, there's a central block of bone. And connected to that block of bone is a ring of bone. That ring of bone is composed of what we call the spinous processes, as well as the lamina. When you're doing a laminectomy, what you're doing is essentially you're taking out the lamina.
We remove the back part of the spinal canal, as well as the ligament underneath, to decompress the underlying neural sac to allow the nerves to conduct their signals unimpeded, and thus help patients with spinal stenosis symptoms of leg pain, cramping, weakness, sciatica. Oftentimes, laminectomies, 1-level or 2-level laminectomies, the patients can go home the same day. Recovery after laminectomy usually consists of taking it easy for a few days. Usually bending, lifting, twisting restrictions after surgery last approximately 6 weeks. During that time, the patient can resume regular everyday activities,